Hi, Robert. How are you today?
Good, thank you.
Thank you for being my test patient for my health assessment.
No problem.
My name is Janelle, and I'll be doing your health assessment, your focused health assessment. And everything I do, I'll be letting you know as I do it. If anything is uncomfortable or doesn't feel good, just let me know.
Okay.
Okay. So I'm gonna start with assessing the skin, and Robert's hand is warm, dry. Skin is intact with no pigmentation issues or lesions. Hair is evenly distributed. The nails are clean and smooth. No clubbing noted or cyanosis. And cap refill is less than 2 seconds, which is within normal range. Okay, looking at his head and doing visual assessment. His head is symmetrical, and visually there are no lumps or abnormalities or dandruff or sorry. See, I'm going to feel the hair. No nits. Hair is evenly distributed, and no lesions, no nevi, in normal cephalic shape. Looking at the eyes, orbit, they're symmetrically placed. The eyebrows are full and go to the outer aspects of the eyes. There's eyes are symmetric with no exudate or crust around them. Can you look down and look up? Okay. No ptosis visible. The sclera is clear with no injection and no yellowing indicating jaundice. The eyelashes are also evenly distributed and not sparse. So I'm gonna palpate the lacrimal glands. The lacrimal glands are not palpable. Any tenderness?
No.
No. And no redness or exudate. How about the sinuses? Does that hurt at all?
No.
Okay. And this felt okay?
Yes.
Okay. And let's see. Well, then normal. We're gonna check your EOM. So up here, follow my hand. Sorry, follow my hand here, 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 here. No strabismus or nystagmus indicated or observed or noted. Oh. And can you look at my hand here? Can you look behind me? The wall? Can you look at my hand here? Okay. Pupils were constricting and accommodating to far and distant. And then let me see. Okay. Yeah. Okay. Pupils are equally round and reactive to light, and obviously accommodation for when we did far and near. And now I'm gonna look at your discs. So if you just look straight ahead, don't look. Red reflex, and the optic disc has sharp margins, and the vessels are intact without any hemorrhaging or exudates. See. Okay, going to be assessing the ears. The ears are symmetrically placed on the head. First, I'm gonna see if there's any pain, any discomfort here.
No.
What about here on the tragus?
No.
Any mastoid?
No.
Pain? Okay. I'm gonna, for the sake of time, I'm gonna assess with the otoscope one side of the ear. Minimal cerumen tympanic membrane is pearly gray with the cone of light at 5 o'clock, which is normal for the right side. On the left side, it would be at 7 o'clock. And no abnormalities or lesions or growths noted. Okay, maybe tip your head up slightly, please, and go check your nose. All right. The nasal mucosa is pink and moist with no exudate and no discharge. The turbinates are pink as well. And the septum is placed midline with no deviation or perforation. See. Oh. Can you get this tongue bleed? Okay. Assessing the mouth. The lips are pink and moist. No cracks or sores externally. Could you open your mouth for me? The mouth is pink and moist. The buccal mucosa is intact with no lesions or sores. Teeth are intact with no losses and no visible caries. Can you stick your tongue out for me? Say ah.
Ah.
Okay, tongue protrudes midline and the uvula rises and falls with phonation, and the pharynx is pink with the tonsils pink and not red, and no exudate or plaque on them. Okay. See. Lymph node. Okay. I'm gonna palpate the lymph nodes. So pre-auricular, post-auricular, occipital, tonsillary, submandibular, submental, supraclavicular, anterior cervical chain, deep cervical chain, and posterior cervical chain. Did you have any tenderness?
No.
So no tenderness noted. While some of the nodes were palpable, none were enlarged or hardened. Let's see. Thyroid. Let's see. And can you tip your chin up a little? Trachea is midline. And can you swallow for me? Okay. Thyroid is right under the cricoid cartilage, and I can palpate it. I felt no nodules or masses, and I can move it from left to right, finding the outer aspects of the thyroid gland. It is not enlarged, it is normal size. And can you look that way for me? No jugular vein distension. And you can look back at me. Thank you. Okay, we can do cardiac. I'm gonna move this here. Would you do me a favor and lay that this way, and I'm going to move the camera. Okay, I'm going to palpate the precardium. So, feel any tenderness?
No.
I don't feel any masses. Also, palpating over the 5 aspects of the chest, or over the 5 valve areas. I don't feel any heaves, thrills, or lifts. Using the diaphragm of my stethoscope, listen to the mitral and the aortic on the right at the second intercostal space, pulmonic, second intercostal space on the left, Herb's point at the third intercostal space, tricuspid at the fourth, and mitral valve at the fifth. I'm gonna also listen with the bell to see if there's any murmurs in all those same places. Mitral. I'm also gonna palpate at the apical, which is also at the fifth intercostal space for strength. Normal rate and rhythm. And could you do me a favor and roll onto your left side a little? Gonna listen to the mitral valve for any murmurs with the bell. Okay, perfect. He has a normal rate of about 60, in the 60s. His rate is normal and rhythm is normal. Normal heart rate for an adult is between 60 to 100 beats per minute. And you want to come up? Okay. Oh, and I forgot to listen to regurg. This one right here. For regurg. So assessing for murmurs for the aortic, we're gonna pull forward. Can you lean forward just a little bit? Thank you. No murmurs or regurgitation heard on any of those. On any of those points. Let me go. Okay. Okay. For moving on to respiratory, I'm doing a visual inspection of respiratory rate and rhythm. I'm noticing that there are no accessory muscles being used. His breathing seems easy and not laborious. And no accessory muscles used. So his rate is about 16 breaths per minute, which is in the average range of 14 to 20 breaths per minute. Let's see. Yeah. Checking asymmetry on lung expansion anteriorly. And so I'm going to cuts starting here. Percussion was resonant throughout with mild dullness over the apical area as well as the liver. Now we're going to listen with the diaphragm. Can you take deep breaths in and out with your through your mouth, please? Lung sounds are clear throughout with no adventitious sounds of wheezing or rhonchi or crackles or rubs. I'm going to move to the anterior side. Can you turn it? Posterior aspect. And I'm also noting that his AP diameter is 2 to 1. Again, let me see. Move up just a little bit. Okay. Again, in a ladder formation with 5 areas down, 2 on the outer aspects. Listening. Oh, percussion first. Do you have any tenderness? Right. No masses or lumps felt. Okay, resonant throughout, no hyperresonance with indicating like air trapping or anything like that. Can you take deep breaths for me again? Lung sounds clear without any adventitious sounds noted. Okay, come back over this way and scoot back a little bit. Okay, so go way down. I'm going to assess the peripheral vascular area, starting with I'm gonna start with the brachial pulse. Let me have your hand, because I already assessed the carotid. Strong. Checking the popliteal. I would do the femoral, but I'm going to skip that in the exam, but I would do femoral and then popliteal. I'm doing the, I think she has to see where I'm placed, because you scoot back so I can show your leg. Your leg, I guess. Okay. Posterior, tibial, and dorsalis. All +2. Hair evenly distributed on the lower vascular system, with indicating no peripheral vascular issues, no sparseness, no absence of hair here. So Come back forward. Thank you for participating in this exam. Do you have any questions?
No, ma'am.
Okay, thank you.
Thank you.